Yeah, makes sense. And you said in the beginning that you thought that the motor skill training would be the best for preterm babies. Is this the reason you think it's the case, that it's just more challenging rather than, for example, walking, which is easier task in many ways?
I cannot really respond to this in the sense of from the evidence, because we have only limited knowledge on the intervention that's work in children born preterm. So it's not preterm babies, though they were in child age. Okay, when we think of the preterm studies, so as I said, it was at child age, so they were born preterm, but child age. We did the intervention, and we do not know too much if they would benefit from the same from, for example, aerobic exercise, because there's just a lack of intervention studies with this sample. And I could imagine that actually when they do something else, they could also have some benefits. When I think of aerobic exercise, you sometimes have similar mechanisms, but also you have more like I would say, maybe an unspecific effect, because you have changes in BDNF levels, maybe you have changes in the capillaries in the brain metabolism, and those are like changes that appear to be more global. And so you probably have changes that are not restricted to a different or to a specific cognitive process or brain region. So you would expect maybe also some benefits, but not too specific. Yeah. So
Yeah, makes sense. Yeah, and if I ask, then I think you said that you had also with the school aged children some studies about the acute effects. Would you like to tell about those studies?
yeah, so the trend in acute exercise research, at least for when you look at the age group of children, I think they have the idea that you could implement exercise as part of curriculum in a day. So, for example, when their cognitive performance is decreasing over the class hours, then you can do like an exercise break and recover some kind of some cognitive resources. I think that's the idea why this kind of research would be, yeah, of practical relevance. But actually, there are not too many studies that look at the duration of the effects, because that's what's interesting. So when you have like a 5 or 10-minute break of exercise and you can see these benefits, we don't know really how long they last. I mean, there are some studies showing that you have like 1 hour or 2 hours duration where you can benefit, but we are not too sure about how long it takes. So I would say that's also something where we should look at in future. And that's also what we're trying to do, not looking at only the effects, but also at the duration of the effects, that we can get an idea, is it really worth the effort doing like a single exercise break to recover cognitive performance?
And if you think the school day, you can have kind of exercise breaks or activity breaks, or you can have them kind of all the time in a way that you don't need to sit all the time. You can stand up if you want. You can do something in the class. It could be also that you can teach math by carrying different things. If you need to calculate 2 plus 2, you can carry two heavy things together and then count how many there is. So I think there's many ways of doing. Do you have any idea from the brain's perspective that would it be good to be trying to be active throughout, or kind of having sessions of exercise?
Okay, so there's a different definition, I would say, of exercise breaks, because some people say that an exercise break can be like if you're in the classroom, you stand up, you just walk around, make some kind of movements, and that's sometimes the idea of active schools, what you do. And this has some benefits, surely, but I think for cognitive performance, it's better to have like a structured approach. So, for example, like a 5 to 10 minute break, but at that time you're really doing some kind of exercises. And I think that's different from the mechanism, because maybe when you stand up and walk around, you have something like you recover your mood. You have like different mechanisms in place. You could maybe also listen to music or do something different so that you can recover your attention. And it's not like a purely physiological effect. But when you look at these exercise breaks in the sense of a structured exercise during 10 minutes in a row, and you do with a certain intensity, then you could expect maybe an effect that actually has its origin in the brain, because when you start exercising, then you have a release of hormones, and also you will recover your attention. So that's what we know from many acute exercise studies, that actually the brain has a process describing, or that can be described as reallocation of attention and resources. And we always try to handle our resources. That means we try to flexibly allocate our resources towards the information that is important. And with exercise, we can recover or improve this process. It means increasing its effectiveness. And yeah, I would say that's a mechanism that's related to the brain, and we can benefit from this mechanism when we use really exercise as a continuous session. So I think you also asked, what should we have exercise breaks, or should we have it in a row? I think for the long-term effects, when you're looking at the promotion over a certain period, then probably having a longer session during a day makes absolutely sense. When you want to have these quick benefits, just temporary, but they can help you just surviving the afternoon hours in the class, for example, then it makes sense to have short session throughout the day. And I mean, in a really perfect world, we could do both.
Yeah. And I think there's probably two different kind of things in the play. It's the kind of the adverse effects of sedentary behavior and just being stationary. I think there's some studies, for example, from Liverpool, that they measured the brain flow, and after, I think it was 6 hours of sitting, you already see that the brain flow has decreased. So kind of you can counteract that probably with very little activity. It seems from the enzyme studies that you can change the enzyme activity or kind of activate them again with just 1 or 2 minutes of walking, maybe even if you overweight just about standing up. So it's kind of that. And then there's kind of exercise where you actually need to have some activity continuously, probably a little bit heart rate up, and maybe some challenge also for the brain from the motor perspective, and probably those are the things that you should be considering in the school context.
I would say for this acute exercise paradigm, there we have the strongest evidence for aerobic exercise that actually, that there are benefits. So it's a little bit different from the long-term exercise, where we have a tendency that actually maybe coordinative exercise might be more beneficial. But to be honest, on the other side, you also need to note that actually aerobic exercise studies are the majority of intervention studies we have. And I think we need more on the motor skill paradigm. But for the acute exercise, you can really expect benefits from the aerobic exercise sessions.
Yeah, I think I had the recording. I think it was in the episode with Kirk Erickson, and he was also saying the same, that the most studies are with aerobic exercise, and there's not so many studies with strength training. But it seems that both are good, and also probably the motor skill training. So now we have covered the preterm born children and the school studies with acute. Is there any other topics you would like to cover?
I think everything I do is quite related. So I also do these studies with children with ADHD, and they have some similarities when it comes to their symptoms. Maybe what additional kind of sample would be children with autism spectrum disorder. There we did one study, and it was the first cohort where we had negative effects of an acute exercise session. So we always had either no effects or benefits. And for these children, we really had negative effects. So after a simple aerobic exercise session, they had worse performance on social cognitive tasks. So I think that's quite interesting, that you can see also a different pattern of results.
Yeah, that sounds interesting. And do you have any speculation on the Why is it that with the autistic spectrum disorder?
Yeah, so we were also collecting meters on stress and also using salivary cortisol. And what you would expect when you have moderate intensity exercise, that cortisol increases over the session. And for the children with autism spectrum disorder, they had the opposite direction. So they had stress peak at the beginning of exercise, and then it decreased over the exercise session. But still, when compared to a control condition, it was higher in the exercise session. So probably for them, the exercise task was some kind of stress, and this stress actually led to negative effect on cognition. So I would say it's the opposite for many people. The exercise session itself is like has a positive effect on mood, and maybe that's also something that drives changes in cognition. And here I think it's the opposite direction. When you have stress, you usually tend to decrease executive function and higher order cognition in general, just to facilitate more like these quick cognitive decisions. And I think that's what actually happened with this kind of children.
Yeah, interesting. If there's if listeners are interested, there's a episode with Patrick Yakura from, I think he was in Canada, I think now in UK. We had a episode about autistic spectrum disorder and the training and so on. So if anyone is interested, you can check that episode. And maybe about the ADHD, how do you see it? I think I'm not an expert, but I think there's a little bit controversy that is it kind of condition, or is it just kind of temperament is it like kind of personality? Is there anything wrong with them? How do you see it from your perspective? Should children be kind of labeled having an ADHD because it might affect the teacher's attitude, parents' attitude, and so on? What kind of your take from that perspective?
Yeah, I would say, of course, this is a difficult topic, because at the end, the ICD or DSM-5, they tell us what actually is a neurodevelopmental disorder and what is not. And they have their diagnostic criteria, and when it comes to the diagnosis, they just look if these criteria are fulfilled. I'm quite convinced that actually it's a problem, because most of these children have impairments not only in cognition, but this also affects their peer relationships. And for some children, they have like a compensatory, so when they turn into adults, they might not have the same kind of ADHD symptoms and longer. So for them, maybe it's okay, but still they have a time in their childhood where they have difficulties and where they have problems with forming peer relations. And even if this is better when they become adults, they still have this experience. So I think there's still a problem if you leave them untreated, and you should do something. So even when there's medical therapy is not the best for all of them, you should still consider some kind of intervention, because you don't want to have these kind of experiences. When it comes to the diagnosis, I'm quite sure that these diagnosis the ability to diagnose ADHD has been improved. But I also think that when you look at parenting, you can have forms of parenting that actually produce ADHD symptoms. That's a difficult topic, because then sometimes the question arises, is this really ADHD, or is it the fault of the parents? And that's difficult to say. You should not look at children with ADHD and always think of the parents. They made some mistakes. But of course, with some sort of parenting, you can create some of these, or recreate some of these symptoms when it comes to inattention and delayed gratification and things like that.
Yeah, interesting. I think there would be a lot of things to discuss, but I think we are running out of time, as you are very busy. So maybe just a last question, or is there anything you want to promote? Is it open position, collaboration, anything? If you free.
Difficult to say. I would say I'm quite happy at the moment. So I mean, I have a good network. Linked with other researchers in the exercise cognition, and that's a great group. So I really like the active brain topic of the ECSS, and that's where we meet. And I would say this field of research is a very positive field, where you don't get the feeling that somebody does not tolerate other groups. So I would say we are as a group quite good. And other things with regard to promotion, I would say not at the moment. I have no open positions because we try to use our experiences from our students and then hire our students. And in Basel, it's still this way that we have they need to talk German when they're hired, or need to be able to talk in German. And this really excludes a lot of people. So
Yes, I know. I'm trying to learn German currently.
yeah.
So yeah. No, this was great, and you mentioned the active brain special interest group. So our intention is to have also other people from that group in this mini series. But thanks, Sebastian. This was great. Thanks for taking time for the podcast.
Yeah, thank you.